Now, there's a lot of reasons why people might have A-Fib, and we look for all of those. Some of the big ticket items include pre-existing problems with your heart. If the heart is enlarged and weakened from some other problem, if you have a history of coronary artery disease or had prior heart attacks, if there's problems with your heart valves where they don't open or close properly, these can predispose you to these atrial arrhythmias. We usually know about those through a physical exam or your prior history of heart problems. Frequently, we will do an echocardiogram, an ultrasound of your heart, to look at the heart structurally, to see how big it is, how strong it's beating, and how the valves are working. Some other reasons people can have A-Fib include thyroid problems. Hyper or hypothyroidism can cause problems with atrial arrhythmias like A-Fib, and a blood test can check your thyroid function. Alcohol is a big one. If you drink more than about 2 ounces of alcohol a day, that's either 2 beers or 2 4-ounce glasses of wine or 2 1-ounce shots of 80 proof alcohol, that may contribute to atrial fibrillation. Sleep apnea is a big one. Sleep apnea is a disorder of breathing during sleep, and it's much more common in overweight people, although you don't have to be overweight to have sleep apnea. Typical symptoms are snoring, and someone who sleeps with you may notice that you seem to have these apneic episodes where you essentially stop breathing for 20 or 30 seconds at a time during sleep. People are usually very fatigued when they wake up. They feel tired. They have a hard time getting going in the morning. If they're left quiet in a chair somewhere during the day, they're prone to falling asleep, watching TV, for example. What's happening is that when you sleep, all of your muscles start to relax, and your airway can partially collapse. When you're breathing, that air moves in and out through this narrowed airway and causes kind of a flapping sound of snoring. One step further than that is if the airway completely collapses and you stop breathing. That's called apnea. Most people know that if you stop breathing for about 30 seconds, there's a pretty darn potent stimulus to make you want to breathe again. And this is not lost on you while you're sleeping. You essentially start to wake up, but may not wake up fully to the point of consciousness, but enough to spurt, sputter, roll over, and start breathing again. This can cycle through hundreds of times a night and cause disruption of your deeper levels of restorative sleep. It also can play havoc on your cardiovascular system. There's a lot of changes that take place in your blood pressure and heart rate when you stop breathing and have these apneic episodes. So A-Fib is common in people who have sleep apnea. It's common enough that when they show up with sleep apnea, if they show up with A-Fib, we frequently will go looking for sleep apnea. And that oftentimes involves doing an overnight sleep study. There are some treatments for sleep apnea that are very helpful, and we found that if we treat the sleep apnea frequently, we can make some significant impact on the A-Fib problems as well. All right, there are other reasons why people might have A-Fib, but those are some of the big ticket items. As people get older, they're more predisposed to A-Fib. As many as 10 to 20% of 80-year-olds have A-Fib. It's very common as people get older. A long-standing history of high blood pressure, treated or not, is another big risk factor. Family history, if one of your parents had A-Fib before age 70 without structural heart disease problems, you have a 3 times increased risk of A-Fib yourself. And if both parents had A-Fib before age 70, you've got about a 9-fold increased risk of A-Fib. So there is a genetic component to it as well. Now,